Welcome to Pennsylvania Newsmakers, and as always, thanks for watching. Well, first of all, everyone out there, stay safe and stay well. We're coming to you by virtue of Zoom. We're appropriately using safe distance. We have a great show. We're going to hear from representatives from the state's nursing homes and hospitals, very, very important segments dealing with the unprecedented challenges they face. But first, let's take a look at the economy of the state of Pennsylvania and how it affects all Pennsylvanians. As they say, let's get to it.
Welcome to the fast-paced and unrehearsed weekly discussion featuring the leaders who help shape your world. Join us as we address the issues that impact you each and every day. This is Pennsylvania Newsmakers. And now, here's your host, Terry Madonna.
All right, welcome back to the program. Joining me is Angela Couloumbis. She covers all things dealing with the state capitol for the Philadelphia Inquirer. Did I get that right? All things dealing with the capitol. Well, Angela, there's a huge economic fallout from the coronavirus affecting the state. There's so many aspects of it that literally affect not just lawmakers and the executive branch, Governor Wolf, but affect all of us as residents of the Commonwealth. Let's go through a couple of the major fallouts from the coronavirus that affect the economy of the state.
Yeah, sure, Terry. I mean, yesterday, the independent fiscal office came out and with a report and said that over the next 15 months, the state is going to be facing at a minimum a nearly $3 billion deficit, which is going to be very difficult to meet because the state has been facing an unprecedented economic fallout. Revenues have slowed because of the business shutdowns. And because of the business shutdowns, there has been a record increase, a record spike in the number of unemployment compensation claims to the point where the state had been initially unable to meet that demand. And revenue, because of that, is not coming in. As you know, Terry, the main sources of revenue for the state are sales and income taxes, and those are coming in very slowly. And also because of the tax deadline now being moved back 3 months, the state really doesn't have a clear picture of what it's going to be facing as it moves into the next fiscal year, which begins on July 1st.
Yeah, there's also the situation where Governor Wolf, they've laid off state employees. I mean, these are folks who are not in the kinds of doing the business activity of this state that's, quote, essential, I think is one way to put it. Go ahead.
That's right. So the first action that we saw from the administration was that they laid off about 2,500 seasonal and part-time workers. These are people who come in and help, for instance, in the Department of Revenue during tax season. And they have been told that their jobs are no longer there. And then last week, what we saw was that the administration told about 9,000 employees that it will not be paying them starting April 13th. And we don't know how long that's going to last. I think it's going to depend on the how long the state is going to remain in this shutdown mode. And those employees are people who can take, if they have it, some personal leave time or sick time to continue getting paid for a short period of time. But once that runs out, their only real option is to file for unemployment.
All right, Angela, one of the big factors has to do with the state legislature and the governor in terms of how they deal with a whole bunch of situations. There's a push by the Speaker of the House in particular to say that the shutdown of the businesses in the state should not involve construction, both private and public. And a bill is moving through the legislature that would require the governor to literally say public and private road construction, they're all back on the table.
Yeah, Terry, there's been a real debate in the state legislature over Governor Wolf's shutdown order and how far-reaching it should be. The Speaker of the House has pushed a bill that would effectively reopen all commercial and residential construction projects across the state, as long as they can comply with CDC guidelines for social distancing and other mitigation measures. There's also been a push by some Republicans to figure out a way to reopen sectors of the economy, which, as you know, Governor Wolf's order has shut down large swaths of retail and other major income producers for Pennsylvania's economy. So in the beginning of the shutdown, what we saw was a much more bipartisan effort to try and deal with how to go forward and the best way to go forward. But I think that nerves are starting to fray a little bit, and there are some real philosophical differences as to the best way to reopen the state to make sure that businesses can function, people can go back to work once it's all over.
Angela, thanks for coming on the program. You all and your family stay safe and well, and we'll talk with you soon.
Thank you. You too, Terry.
This broadcast of Pennsylvania Newsmakers is presented by the Pennsylvania Chamber of Business and Industry, the statewide voice of business, and by the Pennsylvania State Education Association and Partners for Public Education, bringing the power of a great education to our schools, our students, and our communities. This broadcast of Pennsylvania Newsmakers is brought to you by the Pennsylvania Highway Information Association, the go-to source to learn about transportation projects and issues. Please visit pahighwayinfo.org. And by the Pennsylvania Manufacturers Association. Business in Pennsylvania is our business.
Welcome back to the program. Well, the nursing homes in the state of Pennsylvania are, as I indicated earlier, facing unprecedented challenges. Joining me is Zach Shamberg. He's the president of the Pennsylvania Healthcare Association. They represent nursing homes all throughout the state of Pennsylvania. Zach, I hope you're staying well. Welcome to the program.
Terry, thanks for having me. I appreciate it.
Well, the last time we talked, we got in a bit into the coronavirus and how it might affect nursing homes. But I'll tell you, I don't know that anyone expected it would get quite as serious as it is now. So how has this affected how nursing homes operate throughout the state of Pennsylvania?
Yeah, and you said it, Terry. I don't know that anybody really expected what was going to happen, because this is unprecedented. And in talking to providers across the state and even across the country, this is unlike anything anyone has ever seen before. And it really is the most challenging time that this sector or healthcare providers have ever had. I mean, we haven't seen anything like this since the 1918 Spanish flu. Now, the last time I was on your program and we were sitting in person, I told you that about a week or 2 weeks before it really hit in Pennsylvania, it had first appeared in the United States in Washington State, in a nursing home there, the Kirkland Life Center. And we did all that we could to work with providers in Washington State, our counterparts in Washington State, to learn from them, to ask them, what do we need to be prepared for? And almost everything that they told us might happen or was happening in Washington State is now coming to fruition here in Pennsylvania. I mean, the first thing providers did, based on the Washington recommendation, was restrict or limit visitation, because we believed that the best way to mitigate and contain this highly contagious virus was to keep it out of long-term care in the first place.
Yeah, I mean, in addition to that, there's now a suggestion, I think, from the state. I know you work closely with state officials, that if folks in the nursing homes come down with corona, that you separate them out and keep them removed from the general population. That must be a big challenge, given the fact that how close, I mean, obviously we're talking about older people, many with pre-existing conditions, and they all relate well. They congregate and hang out together. I mean, which is what you want them to do, right? And this has to be what I'll call a major cultural change going on in the nursing homes.
It is. I mean, and again, we use the phrase nursing home. It really is a home for many people. And providers have done a lot of creative things. And I give providers and our healthcare workers all the credit in the world today, Terry, because of the things that they've done and really the new ways they've allowed residents to communicate with their loved ones, residents to communicate with other residents down the hall, the friends that they've made. And this has been a real challenge. And you mentioned kind of making a dedicated wing or floor or even building, an entire building for just COVID positive residents. This is something that other states are doing. This is something that Massachusetts was really the first state to do. It's called cohorting. And this is something that providers in Pennsylvania are already looking at. Some are doing, especially in Southeast Pennsylvania, because hospitals are getting so overloaded with COVID positive residents that they need that bed space. They need the bed availability. And again, I give providers all the credit in the world for working with our health systems to make sure there's available space.
Yep, we're going to run to a break. When we come back, I want to talk about something that I know you believe is extremely important, personal protective equipment. We hear a lot about that in hospitals, but it also has a huge impact on the nursing homes as well. Hang with us. We'll be back in a moment.
This broadcast of Pennsylvania Newsmakers is brought to you by the Cross-State Credit Union Association. Credit unions, where people are worth more than money. To find a credit union that is right for you, go to ibelong.org. And by the Energy Association of Pennsylvania, Pennsylvania's energy information source. This broadcast of Pennsylvania Newsmakers is brought to you by the Association of Pennsylvania State College and University Faculties, representing the faculty and coaches who are devoted to providing quality public higher education for Pennsylvania's college students.
Welcome back to the program. Well, we're chatting with Zach Shamberg. We're into a discussion of the big changes that have taken place in nursing homes. And one of the items that's very important to you is personal protective equipment. We hear a lot about that in hospitals. We hear a lot about it for folks, police and others who are involved in keeping us all safe. What's the significance of PPE, as it's often called, for the nursing homes in our state?
Right. So I think everyone in America has now learned that acronym, PPE, personal protective equipment. And again, that's masks, gowns, gloves, goggles, face shields. When I was on your program about a month ago, we talked about that. And that's one of the proven ways for workers to wear PPE to keep the virus from spreading. Unfortunately, what we've realized both at a national and state level over the last few weeks is that there is just not enough PPE out there for our healthcare workers. And that includes everyone, Terry. That's nursing homes, personal care, assisted living, hospitals, EMS. There is simply not enough. From what we understand, there was an emergency national stockpile. There was an emergency state stockpile. Both of those stockpiles have essentially been depleted. And where most of these products were manufactured, believe it or not, was in the Wuhan province in China, which is where COVID-19 actually began or first materialized. So production stopped for weeks. Now, I do understand that production in China is back up. The president has asked other manufacturers, and I know manufacturers in the state have started producing PPE. I hope that we can get the supply chain up and running because providers are desperate for it across the entire state.
Yeah, one other big issue has to do with the need that you have from federal, but also from state government. What's the sense about what kind of relief and assistance you can get given these challenges that you face?
So again, PPE right now is costing 2, 3, 4, 5 times as much as it normally would. Providers are paying staff bonuses, more money per hour, 2, 3 times more to keep folks in their buildings, especially if there's a COVID positive. So costs are skyrocketing, and we're working with the administration, we're working with the legislature, we're working with the Department of Health and Human Services on many, many things. It's regulatory relief, its priority for testing and for PPE. Terry, I would just send a message to the members of the legislature and to the Wolf administration. This was a sector, this was a healthcare provider group that had been flat funded by the Medicaid program since 2014. And this virus, this epidemic has simply exacerbated every funding issue that was there. They need relief. Healthcare providers need relief. Congress has sent money down to the states. We need to be able to get it in providers' hands.
All right. Yep. Look, thanks for coming on. And I hope that you'll be back on the program and keep us up to date on how nursing homes are handling the coronavirus crisis, the pandemic. All right. Coming up, we have Andy Carter. He's the president of the Pennsylvania Hospital and Health System Association. We're going to find out how this is affecting huge impact it's having on Pennsylvania hospitals. We'll be back in a moment.
This broadcast of Pennsylvania Newsmakers is brought to you by the Pennsylvania Medical Society. Inspired physicians committed to the good health of Pennsylvanians and the advancement of the practice of medicine. And by the Pennsylvania Healthcare Association, the future of long-term care.
Welcome back. Joining me now is Andy Carter. He's the president of the Hospital and Health System Association in the state of Pennsylvania. Andy, welcome to the program.
Thanks for having me, Terry.
Well, I'll tell you what, among the heroes in handling the pandemic, the coronavirus crisis, are the folks who work in the hospitals. I have no clue how they're undergoing and sustaining themselves in the midst of this crisis. They put their own health and their own welfare on the line every single day. It's amazing.
You're absolutely right, Terry. I mean, these are the real heroes of this story. The demands on their time, the demands on their families, and the fact that they have to try to stay safe and healthy to continue caring for patients. It's an extraordinary effort on the part of all the folks working at hospitals in Pennsylvania and around the country, actually.
Yeah, you're absolutely right. Well, let's start with this. One of the big concerns at hospitals, now we've not reached the apex in Pennsylvania. I think that's clear. It's oriented more towards the southeast and up in the northeast in the Pocono regions, but it's throughout the state as well. What are your concerns about? Let's start with testing. Then we can go to equipment, whether it's the protective clothing that's extremely important. We also have ventilators and respirators. What's the status of the hospitals now in terms of what could be a huge impact and rush coming in the next week or so?
Well, we are working around the clock to be ready. And today we are addressing the situation as it's unfolding right now. We're monitoring in every county across the Commonwealth the capacity of our hospitals to address the patients that are coming to their doors for help. And right now we're in good shape with equipment, supplies. Basically right now today, the system is working well to get the equipment and supplies to where they're needed. We have a very strong allocation system in place and working in concert with the Department of Health, the Pennsylvania Emergency Management Agency, and of course, member hospitals. And we're also working with nursing homes and other healthcare providers to be ready. But to your question, if the surge comes at some of the levels predicted by some models, then the system is going to be absolutely stretched to or possibly beyond its limits. And that's what we have to be doing all we can to prepare for. But here's the reality. It would be much better to avoid reaching those worst case scenarios. And there are steps that we can take to do that. You and me, as Pennsylvanians and millions of others, can take steps to avoid the spread and to, you've heard the phrase, flatten the curve. And that's just designed to avoid this surge that the health delivery system cannot manage. So that's why our number one message to Pennsylvanians is stay home if you can and maintain safe social distance from others. Because even if you don't have symptoms, you might be a carrier of the virus and you could infect workers who are supposed to be, healthcare workers. I mean, wouldn't it be terrible for you to be out without really needing to be out, and you ended up infecting a nurse or a physician that you happen to encounter? So we should be all working very hard to stay home and avoid spreading this virus.
One of the other questions that I want to get to has to do with the fiscal, the financial operations of the hospital. Some have been deeply concerned, and I know you're looking for help from both the state and the federal government. What's the financial status of hospitals in Pennsylvania?
Well, the status going into this was strong. We did certainly have hospitals that were operating in the red even before this crisis erupted. We had about a third of our members who were operating in the red. We had even 1 in 5 were losing money year over year. But overall, across the landscape of Pennsylvania, the hospital community entered this financially sound. But once they began cooperating and doing so eagerly to cooperate with the governor's orders to suspend elective procedures and to cancel outpatient visits and ancillary care, a huge hole opened in their finances. Billions of dollars are at risk of being lost. From early estimates that we've been developing, our members across Pennsylvania are each month losing $1 billion in lost revenue because of all those canceled procedures and services. Going forward, they're also incurring huge costs for getting ready, getting the equipment, paying overtime, recruiting additional healthcare workers, physicians, and nurses. These are all very expensive measures. So the financial situation going forward is really worrisome, particularly since when this is over, we want to have a stable and strong healthcare delivery system. We don't want to come out of this crippled and unable to meet the healthcare needs of Pennsylvanians going forward.
Well, look, I want to thank you for coming on the program, and hopefully you'll come back and keep us updated. I mean, what hospitals do is extraordinarily critical to the health and welfare of folks all over the country, but obviously, given your role as a representative of the hospitals in the state, very important to us. All right, folks, we'll see you next week for another edition of Pennsylvania Newsmakers, and please stay well out there. And thanks again, Andy. We'll see you soon.